Hi, good morning, everyone. Welcome to 106th session of CMAAO International Weekly Meeting. We are live on 16th of April from various countries. And it's a long weekend. Good Friday has just crossed. And we are meeting everyone. We will discuss about COVID and all other issues going forward. So I welcome medical associations and representatives from various organizations over here in various countries. So we will quickly start with Dr. Ravi Naidu from Malaysia. Dr. Ravi, would you please?
Hi, good morning, everybody. Good morning, good afternoon, good evening. Okay, well, in Malaysia now, what's happening is the cases are now going down. We are now around 10,000, below 10,000. It's between 9 and 10,000. The booster vaccination has been accepted very well. But one doubt we have is probably what's happening is people have taken COVID like a norm now, like how you have a flu or a cough. People have taken it like that. So what happens is there's under-reporting, number one. Number two, what happens is when people do not do a test, if they have a fever, they just take paracetamol and they stay at home. Or if they're confirmed as positive, they don't inform regarding their COVID positive status, and they just quarantine themselves at home. So I believe there is massive under-reporting going on. But nevertheless, what's happening now with this, this month is the Ramzan month coming up. We expect a lot of movement during that period, and we feel that there is going to be a major break in the number of cases because people are going to travel a lot. And during the Eid Mubarak, as I think many of you will be celebrating, there will be a lot of traveling, especially everybody go back to their homes for the Eid for the few days. Like in Malaysia, it's a 1 week holiday here. And now during the fasting month, what's happening is families get together to break fast in the evening. So there's a lot of movement now, actually. In fact, if you see now, the traffic on the roads is much, much heavier than what it was in the last 2 years. So what's happening is people have sort of accepted it as a norm and they're moving about normally. Of course, there are precautions being taken, SOPs that have been mentioned by the government, like a face mask is mandatory. We have to maintain social distance, but functions are open, weddings, dinners, there are no more restrictions, there's no more numbers, no more, only 6 to a table, those kind of things. So life is actually coming back to normal now, more or less coming back to normal at the moment. And that's the scenario in Malaysia. Thank you.
Thank you, Dr. Ravi. Much needed update for the last couple of weeks. Can I invite Dr. Sajjad from Pakistan? Dr. Sajjad, you're mute.
No, it's okay now.
Yeah.
Okay. In Pakistan, it's almost everything is normal because the number of cases is going down. The people here assume that there is no coronavirus in Pakistan, so they are doing everything against the prevention of coronavirus. Everything. The people are hugging each other, they are shaking each other, everything. They are continuously having meetings and gatherings with close contacts. So you can't see anything. You can feel that there is a coronavirus. Still, we have today, according to the government's report, that 75 cases have been detected positive in Pakistan today, and according to them, 0.4% is the positivity rate. And the vaccination campaign is very slow. The people are having their vaccination, booster dose and normal vaccines, but a very poor quantity of people are going to the vaccination center. But the cases is definitely very low. So all the gathering is going on. Nothing. Nobody is having mask, wearing mask. So last time, one of my friend came with his son to check his son, and he saw me with mask, and he surprised and cried that, "Doc, why you are having mask? No, there is no more corona here. So just remove it. There is no corona here." I said, okay, but there is a corona. If you infected, then you say that there is a corona. So don't campaign against the mask. You have to wear the mask. As an activist of the Pakistan Medical Association, we are still continuously very vocal to follow the SOPs. We are very much awareing the people. Please, corona is very much here. Corona is not eliminated from Pakistan. So you have to follow, everybody should have to follow the SOPs. At least wear a proper mask. Don't shake hand. Don't hug each other, so that it cannot be spread more. So this is the situation in Pakistan. I hope that it will create in other part of the world the same situation, and the corona will eliminate from the world. Thank you very much, Saurabh.
You rightly said, and in fact, I think the message should pass through as, okay, fine, the COVID is not there, but you should still wear the mask, because there are still a lot of diseases, and a lot of diseases are in the air, and at least you should filter your air when you breathe, because of the pollution level which is there in our countries.
Absolutely.
So, can we move to South Africa?
Thank you, Saurabh. I just wanted to know from Dr. Sajjad, this I saw political rallies going on, thousands and thousands of people attending. The crowd overcrowded every day. So you think is the super spreader going to be happen there?
Yes, Dr. Akhtar, I'm surprised. Everybody is very much surprised that the all type of gathering, as you said, the political gathering is very much aggravated nowadays in Pakistan. But the number of cases, thanks God, is going down. Maybe the infection is not so active. The number of cases is very much low. The positivity rate, as I said, is 0.4%. Even the public are very much engaged in iftar parties. You know, the Ramzan is here. The people are normally arranging the parties for iftar. The other parties are still going on. The night cricket matches is going on in Pakistan. So the normal prayers, everything is normal. So God forbid if it's comes any other virus which is not prevented by the vaccine or any other things, then it will be spread as previously. So we pray for the best, but till now it's very much fear in our society that if it is spread the coronavirus, then what will be happen. So now it is everything is okay. It is going down, and the people are attending every program, every jalsa, or what you said, daily aggregations, everything is going on. Nobody is having any fear to avoid the gathering or something. So in their minds that there are no coronavirus in Pakistan. So with this feeling or with this mind, they are attending everything.
I think, Dr. Sajjad, I think on a lighter note, on a candid note, political meetings are always anti-COVID.
Yeah.
It's already vaccinated meetings, I would say.
Yes.
Okay. And And South Africa, last 24 hours to 48 hours, we have 1,846 new cases, and death last 48 hours is 3. Our active cases is 12,900. Our total death since COVID started more than 100,000. Our positivity rate is still 8.4%, and recovery rate is 97.0%. Hospital admission, 2,087 patients were admitted last 24 hours around the South African public and private hospital. ICU cases, 169 in ICU. 55 patients were admitted for ventilation. And our vaccination is going slow. So far, first dose is around 35.6%. Fully vaccinated, 30.6%. Booster is only 4.2%. So the booster is going very slow. The other issue in South Africa, we have a very bad climate change, especially KwaZulu-Natal. We had a severe flood. Roads are washed away. Around 350 people died with the flooded, and the houses are broken. The rain and heavy rain is still going on, and we are expecting waterborne disease will be affecting. The program of COVID vaccination is also slowed down in KZN. Thank you, Saurabh.
Okay, Saurabh, I forgot to tell you that from the last 1 week, approximately, I think 7 to 8 days, there were no deaths in Pakistan with coronavirus,
Nice.
which is thanks God, which is very supporting for the people of Pakistan, that there is no death from the last 8 days.
Okay. Can I invite Dr. Angelica and Dr. Muzoku for the comments?
Yeah, thank you so much, Chair. No, greetings to all. I'm actually based in KZN, like Dr. Akhtar was saying, and I'm experiencing exactly what he's talking about. I think the climate change is going to have a negative impact. I mean, to the already hesitant populations, in terms of the vaccinations. I also understand that parts of the Eastern Cape were also affected, and I believe that is going to cause problems. But if you look at what is happening with this climate change issue, most people that have been affected are poor people, most of them, even though you've got some areas that have not been affected, but majority of cases are the poor. So it says a lot about the work that has to be done to attend to the to close the gap between the rich and the poor. And also what Akhtar spoke about, also the issue of waterborne diseases. I think it's going to be a huge problem in the affected areas. So I think one will have to keep an eye, and obviously there should be obviously education to communities, making sure that what Akhtar was talking about, is attended to. I think that's it for now from my side.
Thank you. Dr. Angelique, you want to add something?
Sorry, yes, morning. I am very worried in South Africa regarding the positivity rate. I can tell you that you can actually double that numbers. People are not testing anymore. So our numbers are underreporting, exactly as what Dr. Ravi said earlier, with as mentioned as well. And what is, however, of a greater concern is South Africa had in the end of last month or the beginning of this month, we had to destroy nearly 80,000 vaccines that's been expired. There's more that's going to expire next month, June and July. Our vaccine uptake, and I've said it many times in this forum, are poor in South Africa. We see currently again, between 6 to 8 months, you get immune escape, regardless whether you've been vaccinated or had COVID before. It's going to happen in other countries as well. It's not unique to South Africa. And I think we need to stay vigilant. And the non-pharmaceutical interventions that are so discarded by the population out there or the citizens, again, worldwide, is going to bite us. We are still in the pandemic. It's not endemic. And I think there is a lot of irresponsibility in behavior, and you're never going to get them back into adhering to protocols. Even if we get a fifth wave in South Africa, it's going to be extremely difficult. People's got their own minds, and I assume that this is going to happen in all other countries going forward. Thanks.
Yep, thank you, Angelique. I agree with you. Can I invite Marie from Japan? Dr. Marie?
Thank you very much. In Japan, the kind of a steady state right now, we are having the Omicron BA2 for about 45% to 70% positive for BA2. And then 42,000 people have been tested positive every day, but no severe patients. So we will now slowly open changing the restriction to the wearing mask or something against the infection. But many people prefer to wear the mask outside, especially in the train or public places. That's all for now, which I can tell you all. Thank you very much.
Thank you, Dr. Marie. And I just want to give a quick update from India. In India, the cases are slightly on rise, even though it's not a panic right now, but we have reported about 975 new COVID cases, out of which 4 were death in a single day. And more than 1/3 cases are out of only Delhi. Closing of schools is not an option right now. It's 0.52% of active cases are in Delhi. The major concern is kids comprise significant portion. Out of, as per the government data, 27% of the people are children who have been hospitalized in Delhi. So let's say 51 cases in COVID, which has been admitted in hospital. Out of that, 14 are children.
जो ये पहले से था.
So the total active cases in Delhi is about 11,300 as per the data which is shown. I agree with everyone that, in India is no different than what the world is doing. We have stopped using masks in the major places. There is no reporting which is happening. It is under-reporting. People are not getting themselves tested. If it's a normal fever, people treat it as a flu. If they have a regular fever, they eat crocine and they just go for work, or they sit at home for a couple of days. And even if the COVID is coming, it's pretty mild and manageable at their end. So the cases are not getting reported. The life is as usual. The life has gone to a normal, but it's a wait and watch because the sudden increase in the little rise of what has happened right now. So everybody is on its toes that what will happen. If there is any major rise, then I think the new guidelines will come from the government. So this was an update from India. And do we have anyone from any other country? Do we have anyone from Singapore or Malaysia? Or Hong Kong who wants to speak? I see some names here, but I can't. Mr. Peng, are you from Singapore? Okay, so I think we have covered most of the countries right now which are here. So if anybody wants to speak, Ravi or Dr. Sajad or anyone from South Africa, we can speak. Otherwise, we can close the meeting early today.
I have a thing that I would like to concur with you.
Yeah.
That I think we need to change our topics hereafter.
Yeah.
Because COVID seems to be like a norm for everybody now. So maybe we come out with different speakers from different parts of the world. You know, maybe Pakistan, from South Africa, from India. Maybe I'll try from Malaysia, from Japan. I think that would be a good thing, you know, so that we can continue this this session on a weekly basis.
Okay,
Thank
Dr.
you.
Peng, are you a doctor? And you are from China. Are you a doctor? Would you like to speak something and give us an update? Because we have been missing updates from China, and I think it's a very important update. Do you want to speak on this forum right now? Okay. Okay, perfect. So so I open this forum for you know, people can directly contact me if they want to speak on this forum. I agree with you, Dr. Ravi. We want to move out of COVID now, and I want specialists to come forward and talk about either their own specific field, how they can help the society. We can have topics on specialization of people. Let's say an ENT doctor can speak on about, you know, the critical care about ENT or regular lifestyle modulation, what we can do to save ourselves. So I think precautions is better than cure. Let's make this subject over here. So every person who is talking in their own field can talk about what they should do in terms of precautions, what is going on in their field, what is it that they have to look at the first symptom, when do they have to go to an hospital, when do have to be in a critical situation. So all those things, and if some field is affected by a long COVID, they can cover that part also. Anyone has a suggestion, please let me know. I also invite and request people to give me names for the speakers. We have about 4 sessions in a month, so I don't think that's a very big difficult thing to find. But let's continue these sessions and let's create a knowledge think tank with all and upgrade the knowledge for the public. Anyone has a suggestion?
Sarup, is Angelique here.
Yeah.
You had, I think it was last year, we had, for me, that was a very interesting topic around the biomes, the intestinal biomes, and you had someone, I think from India as well, who talked about the different more natural type of diets that you can use.
Yeah, I know.
That was very, very interesting, and I think
I will try to get her. I think you're talking about Dr. Ishi Khosla.
I think so, and it was very short. I think, you know, we can learn more about that. It's I think there's a lot about, and that fits in with lifestyle. I'll
speak to her today, and it's a good suggestion. Let me speak to her, and she's more into, you know, how to control your body problems by the diet, by what you intake in the body. A lot of things comes behind the medical science also. So I think it's a very important topic. We will bring those more sessions with it. I'm also thinking of bringing yoga and you know, all other things which can affect a long-term thing. So let's see, but suggestions are welcome. Let's connect the medicine with the other field of medicines also, other fields of life. Thank you everyone for joining in. It was a short meeting, but I think it was a lovely meeting. Especially for people from West, always prefer to have a short meeting.
Okay. All right. Thank you.
Thank you so much for joining in,
Thank
everyone.
you.